My name's Frederick. I am involved with the Democratic Party here in Oregon. I've had a few other lives in different places on television and here at Cascade campus as well as with the Portland schools. But so I recognize an awful lot of you folks in the room from various venues, and it's good to see you. Thank you very much for being here. I know you're here for many reasons. Perhaps like me, it's a personal story. That healthcare costs for me and my family are a very important aspect of what I'm dealing with right now. Or there's someone close to you who is also dealing with healthcare issues. I have a best friend of mine who is right now fighting breast cancer again. But 3 years ago when I was running for office, I was, every time I walked up to a door, just about every time I walked up to a door, the issue was healthcare costs and health issues. And they told me that constantly, that the problem they were having was staying healthy. But today, this afternoon, for a short time, we're going to have a discussion about health. Notice I said discussion about health. I did not say debate about health. Let me say that again. We're going to have a discussion about health. We're not going to have a debate about health. We're going to hear a few personal stories. We're going to hear from Congressman Earl Blumenauer and Governor Howard Dean. And we're going to hear a series of, and we're going to have a series of questions about health and health care and single-payer issues and public options and the various plans now being considered. Did you notice that list that I just gave? We're going to be talking about all of those things. Again, we plan to hear from folks here in this room, and there are some folks in an overflow room as well, and we're going to be getting questions submitted from them as well. We're going to have questions, not speeches, and I'm going to say this again, not debate points, and we will be talking about all of the issues we can get to between now and around 5:30. But first, I want to introduce you to two of my friends who just happen to be also our hosts here at Cascade campus for Portland Community College. Preston Pulliams is the president of Portland Community College, and for those who do not know, Portland Community College is the largest college in Oregon by quite a bit. It is, and in fact, there's a question about whether it may in fact be the largest, it may be larger than any of the other colleges put together, the higher education schools put together, which is very possible. But Preston is also, as I said, I'm very proud to call him a friend of mine, and he is going to welcome you to Portland Community College.
Thank you. Good afternoon. Just want to officially, formally welcome you to Portland Community College and the Cascade campus. You're going to hear from Dr. Gatewood in a few minutes, the campus president here. When you think about the challenges for our federal government and for all of us, you think about the two wars, recession, housing crisis, the banking crisis, and the challenges of the automobile industry. Now we are adding health insurance reform. 10 years ago, PCC's premium here at the college for family coverage was $423 per month. Today, it's $474 for employee only. For family coverage today, it's $1,471 per month. We're projecting annual increases of 10% for increase for health insurance. This means the price of health insurance more than doubles every 8 years. This system cannot be sustained. It is simply broken. The business community, the private sector, like community college, are literally begging for a new way of doing business. So that's why I'm very proud to serve as one of the hosts for you to come out and talk about this very critical issue. Governor Dean and Congressman Blumenauer will be here shortly. They'll take the stage certainly to lead the discussion. We thank you for participating. We thank you for discussing and delivering part of the solution. Thank you and enjoy the forum.
Thank you, Preston. The next person to come up is Algie Gatewood. He is, as Preston said, the president of this campus for Portland Community College, the Cascade campus for PCC. I always have to tease him a little bit because he and I share the same birthday. I'm sure you'll notice that he's a little older than me, but that's another story.
First, let me say this to Lou. Lou, thank you very much. Now let me set the record straight. As my friend Barack Obama, President Barack Obama would say, let me be clear. Luke and I were born on the same day, same month, same year. I won't go any further than that. I am absolutely pleased and privileged and honored to have you all on the campus today for this special forum. You know, one of my visions for this campus is to make it the educational, cultural, and social hub of the community. And I believe that when we can have a discussion on a matter as important as healthcare, then we're beginning to realize that dream or that vision. So thank you so much for being here. Nearly 9 million Americans have lost their healthcare insurance since 2000. 1 in 6 Americans have no healthcare insurance at all. That's more than 50 million people. Millions more are underinsured, and 75 million Americans don't have enough to cover themselves, not alone their families. Today we talk about some options for fixing this, I guess I can say, badly broken system. So again, I thank you all for being here and partaking in this very important conversation about healthcare. It matters to you, it matters to your families, your friends, it matters to me and to my family. Thank you. And thank you, Luke. And I said Luke on purpose.
It was only about 3,000 miles apart, and he was 3 hours earlier, I think, as I recall. Just want you to know. The next person to come up is Judy Auslander. Now, she has a story about her experiences, and I think it fits. I'm sure that we all have stories that can begin the process of understanding what it is we are facing and what it is we need to do. Judy has quite a story, and I'd like for you to come up, and I'll move the mic here. Is that correct?
Forgive me one moment. It's part of my demonstration. Whoops, but maybe it won't all fit. Oh well. Maybe sliding. Whoops. Well, they're not all going to fit. Well, you get the idea. And it goes on and on and on. Okay, because these are all and I'll tell you about them. Hey, they're staying up now. So you have the magic. Whoops, well, can I see? Magic on. Okay, and I think that's it, good. Okay. Oh. Well, anyway. Forget it. That's it. Okay. Well, hello. My name is Judith Auslander, and I live in Beaverton, Oregon. And does it sound okay? Because it's okay? Good. Thanks. Okay. Well, I'm a statistic. Just in case you didn't know it, here I am, statistic. I'm one of many Americans, in particular Oregonians, who are without health insurance. And I'm also a statistic because after the birth of my son in 1974, my one and only child, 1974, I nearly died. After a difficult birth, I was left unchecked in the hospital room, in the recovery room, and Because I was unchecked, I was allowed to hemorrhage 7 pints of blood. Since the average body only holds 9 pints, I was significantly low. So somehow they managed to save me, and when I left the hospital a week after my son's birth, very weak and unable to walk or lift anything, I was just excited to be going home with my son. However, I continued to feel worse and worse. And after 12 years of searching for an answer, that's 12 years of searching for an answer as to why I was ill, I was finally told that I was dying. So for 12 years, I went to doctors stating something was wrong, and for 12 years, I was literally patted on the head and told it was all in my mind and to just go home. It wasn't until, as I said, 12 years after my son's birth that I was finally diagnosed with Sheehan's disorder. Sheehan's disorder is very rare. Only 1 in a few million women have it, but is easily diagnosed if you have proper medical care. I did not have health insurance. I got poor medical care. Here I was 37 years old, and I was told I was dying because my body was more like an 80-year-old woman's body. With medical technology and all these medications that will not stand up, okay, I'm able to stand up. Okay, with proper medical care and these medications, I'm able to live a relatively normal life. I look pretty normal, I think, so, you know, pretty normal life. The thing is for the past 34 years, I have been continuously fighting to get the health care I need in order to survive. Because unless I'm able to work a full-time job that happens to also provide health insurance, I am unable to get health insurance of my own. Why? Because I have a very obvious pre-existing and no insurance company wants me. Last year, I was one of the few lucky ones who was picked in a lottery, a game, a lottery to get OHP. Yay! And so because I had met the low income restriction at that time, which is the 100% poverty level, I was able to get onto OHP. However, I had the audacity to earn over the 100% poverty level of $855.67 at the time. And so on October 31st, 2008, I was told I earned too much and I was eliminated from the OHP. I have been appealing and fighting this ever since, and believe it or not, I still have OHP, but until the end of this month. So, and it's, thank God I have it, because just 2 weeks ago, I was riding my bike, I decided to butt heads with a tree, and I ended up with a concussion. I only found out about this because I had OHP and I went to emergency. I would not have gone to emergency had I not had insurance. So I've been told by DHS, who I went to find out about insurance, that I need to apply for disability. I do not feel that I am disabled. I work for a nonprofit part-time, and I run my own business part-time as a life coach, and I do not feel that I am disabled, but neither one of these positions have health insurance. I am an active volunteer in my community. However, in order to live, I have to say that I am disabled. So I applied for disability, and knowing the results in advance, it was exactly as I expected. I was turned down. So I've denied. I can appeal if I want to, get an attorney, costing the state a whole lot more money to be registered as disabled. My other choice is to just lie down and die. And that's not a choice I choose to make. I choose to keep fighting. I don't know how many other people are in my situation, but the question of worth starts coming up. Am I worth keeping alive? Am I too expensive for the state and for the country to keep me alive? Maybe I'm better dead. You start asking these questions. I think I'm worth keeping alive. But without my medications and seeing a doctor, it's a death sentence. So why should anyone have to struggle so hard and jump through so many hoops just to get medical care? It is ridiculous that insurance companies are able to refuse people due to pre-existing diseases or conditions, to raise rates to exorbitant amounts, as we were just told about, while taking in huge profits. Many agencies and others have stated to me how they want so very much to help, but that their hands are tied. I say, let's untie their hands and let everyone have the health care that they deserve. The longer we wait, the worse it is going to get. I have been involved in statewide efforts to reform our system, but we can't rely on states alone. We need a federal solution. People everywhere must have medical care, and not just care for emergency situations, but preventative health care as well, such as vision and dental. For myself and others, the time for change in health care is immediate. Tomorrow may be too late. Thank you.
Thank you, Judith. Next to come up is, I don't know how to describe, one of my friends here. Terri Mills is a nurse, but Terri Mills is much, much more than a nurse. Terri Mills is a force of nature, I think. She and I got to know one another because we began to be involved with the Howard Dean campaign in 2003 together. And she was very heavily involved in that campaign and continued to be connected with the Dean campaign, with Democracy for America, and with the National Nurse. And I have a feeling, just a guess, that she's going to bring that up as she talks to you. Terri, would you come up, please? Thank you.
Thank you, Lou, and thank you, Judith, for sharing your story with us today. My name is Terri Mills. I want to welcome you to Portland Community College and to say thank you to each one of you for attending this very important event today. Some of you know me, but most of you do not, so please allow me this very brief introduction. I am an Oregonian. I am a wife, I am a mother, and I am a registered nurse. In fact, I have the best job in nursing, one that I aspired to during my first semester of nursing school. I am a nurse educator, and I teach at Portland Community College. I am a proud member of the Oregon Nurses Association, and I am also president of the National Nursing Network Organization, a nonprofit corporation dedicated to ensuring that generations of future Americans are guaranteed access to health care, just like some generations were of past generations of Americans. I still very seriously take the Florence Nightingale oath to heart. I will devote myself to the welfare of those committed to my care. And next week, 90 nursing students will graduate from PCC, and they will take that same oath during their pinning ceremony. Now, there have been many changes in the healthcare field since 1973 when I graduated. One memory that I have was during my pediatric rotation. I was warned by my clinical instructor, don't get too close to those children. You see, I was working at Stanford Children's Hospital, and it was a leukemia unit, and every one of those kids died. My drug book was only about 100 pages long. My students would drool for a drug book like that today. About all the equipment in a patient's room was a glass thermometer, an IV bottle, and maybe some oxygen tubing. Thanks to technology and the wealth of our country, we have been able to make great strides. And today, kids with leukemia live. There are more contraptions in a patient's room that we barely have room for our patient. And there are actually so many medications now that you can make rhymes out of some of the drugs' names. Yes, we have made some gains. There have been some dramatic changes, but on balance, the reality is that our healthcare system is simply a mess. In fact, I refer to it as the United States sick care system. Health promotion is disappearing more rapidly than the ice in Antarctica is melting. What we could use is a public health nurse leader in every state and a nurse in every school. And Martin Luther King was equally troubled by America's healthcare system, and this was 50 years ago. King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Now, you know America prides itself on being the wealthiest power in the world, but when it comes to healthcare, we have little to brag about. In fact, we spend more per capita on healthcare than any industrialized nation. And what do we have to show for it? 48 million uninsured, many more millions underinsured. 18 other countries are doing better at reducing preventable deaths than the United States. And the US ranks 29th among all industrialized countries when it comes to infant mortality. Every year, $1.3 trillion is spent treating 7 of the most common chronic conditions, and those are preventable. And the personal stories that nurses, including myself, could share with you are equally distressing. We are seeing on a daily basis patients who ignore their symptoms, and they don't seek treatment until they are so sick that there are few options left, and the ones that are astronomical in cost. I am personally tired of hearing my patients say, how much is this going to cost? Instead of saying, what will make me feel better? And I am tired of hearing unhappy people who have a health condition being tied to a job that they don't even like, just because it provides health coverage. And if they quit, then they won't be able to afford their medication or their appointments. Have you ever heard Michelle Obama say, I am only as happy as my saddest child? If you are a parent, you know exactly what Michelle is talking about. Well, as a nurse, a community and a society are only as healthy as the sickest individuals within it. I want a healthcare system that allows choice, is affordable, where everybody is in and nobody is cherry-picked out, one that seriously promotes prevention, and one that allows you to move freely about the country. Now, nurses have many reasons to be excited about the pending revisions in healthcare. We deal daily with the consequences of our fragmented patchwork of health coverage and with the uninsured. I know there are hundreds of colleagues of mine who are extremely disappointed that a single-payer plan is not on the table, but realizing that unity will result in power, they know we must unite and join together to ensure that a public option is made available. Today, we await anxiously to hear Governor Dr. Howard Dean's prescription for healthcare reform, and we are so fortunate to have Congressman Earl Blumenauer by his side. You, the members of our community and our families, are all feeling the fierce urgency of now when it comes to healthcare reform. Change in the healthcare system will happen, but we cannot afford for our voices to be silent. It is up to us. There are enough leaders in this room to make this happen. Remember, we have the power to change this country. We have the power to take our country back from the insurance and pharmaceutical industries, and we have the power to make sure that healthcare is affordable and accessible for every American. Thank you.
We will be waiting for Governor Dean and Congressman Blumenauer to arrive, and they will be here shortly. So if you want to stand up, get a little exercise there, or at least stretch, this would be a good time to do it. Yes. What her solution is, Terry? What your solution would be? Sure. Oh, you took my notes from me. See, you took my line and you took my notes. That's not fair.
Well, again, those of you who know me have known that I am very pragmatic. I've been in politics for a long time now, and I want to get something on the table that will happen. I don't want to, I want single payer, just like everybody in this room wants single payer. There's no one in here that does not want a single payer plan. But the truth is, and if you, we do have the power to do it. Let me finish. We do, and I agree with you. I have been on Capitol Hill many times, many, many times in the past 4 years, and I've seen firsthand how things work there. And it's not like how it is with us. When we talk, it's open door, and we have our jobs. We don't have to raise money to get elected. Unfortunately, that is our system. We have a capitalistic system right now. And unless we totally decide that we're gonna overthrow every single thing about it away, that's what we have. That's the reality. And I wanna get something done, and I want that public option, and I'll tell you why I want it. Because it will allow for choice. It will be the beginning of the single payer. It will demonstrate and show the data that yes, people will go into this public option and they will have insurance and they will be able to get the health care that they need, and nobody will be excluded because when they were a child they had asthma or they had ulcerative colitis or whatever that condition is. So that's my solution, and I'm going to turn it back over to Lou.
Thank you, Terry. At this point, I get it. I don't know why my voice cracks like that at times, but it does. At this point, I am really in a very privileged position. There are two fellows who are coming up here shortly who I have enormous respect for. One I've known since 1974, and the other one I got a chance to meet after he began his presidential campaign in 2003. And I've gotten a chance to meet him several times. Both have been supportive for me, both politically and personally. Earl, I first met him when he beat me in chess at a chess tournament. I did not expect him to do that, but he did very well and easily, apparently. Dr. Dean, it was suggested by Sue Hagmeyer that I look at his website and listen to some of his speeches back in 2003. And when she said that, we both sort of went, oh, we've got to know more about this guy. And so we began to do that. And we held a Democracy for America, a Dean for America meetup for 5 years as a result of that. So I am very pleased to get a chance to introduce these two, if they are in the back door there. I'm not sure. Let me check. They are? One more second. That's what happens when you have an introduction and you can't see through things here. Keep talking. I used to do that. I got 30 seconds. Yes, I know. It is a situation for all of us that health care is something that we worry about and are concerned about for all of us, and it's not health care as it is just being healthy. And it's about time that we began to really work with that. And I am very pleased that I get a chance to be part of this effort. I think it will last. And as I think Terri said, there are enough leaders in this room to make these things happen. And it really is up to us. It's not waiting for someone else to do it. It's up to us to make sure that we're talking with all of the people that we can potentially talk with. And that's not just local folks. That's not just Congressman Blumenauer. It is all of the Oregon delegation. It's all of Congress. It is taking a chance to talk with the business leaders and make sure that they are speaking up, because it's costing a lot of money there for them. It's also getting a chance to really talk to your neighbors. That's an interesting situation, understanding who your neighbors are so that you can talk to them. So if you get a chance to do that, that would be great. How are we doing? Hello? 30 seconds. Oh, yeah. Oh, yeah. 30 seconds. These are, yeah, thanks a lot. Yes? That's a good question. How many in this room do not have health insurance? How many of you how many in this room are right now paying off health bills, that even with the health insurance? Well, underinsured is another thing altogether. How many are underinsured? I think we're going to get everybody there. We have a situation that exists in our country that is simply unacceptable.